Hello, everyone. This is Danelle Dixon, Performance Plus Physical Therapy, and I am here at the airport. Some things went on with my flight, but I promised that I would come on here and start talking to you guys and have a special guest on, which is a pharmacist. So I'm gonna see if she is on right now. And I don't quite see her just yet. Let's see. So, and I am also connecting to Instagram here. Hi, guys. So I'm at the airport, and as I said before, I am going to be bringing on a friend of mine, Miss Ola Davies. She is a pharmacist, and I would love for her to come on here and talk with you guys. And I think she is here. This is Ola. Ola, are you joining us? Hi. I don't see you on the feed though. I thought you would come up in the screen. Let's see. I don't see how to bring you in. I thought I did. I'm gonna try again. Added you. I see you, but I don't see you. There we go.
Hey, Dana.
Okay. Facebook is adding her in. There she is. Awesome.
Hello. So,
Hi.
disclaimer, I didn't realize I'd be on screen. So, let me be a safe citizen
No worries, no worries. Hi guys, and I
and
hope on
get
IG you
going
guys
where we
can
get to.
see there's some kind of doing a little bit of double time here. So y'all, this is Miss Ola Davies. She is a pharmacist, and Ola, no worries. This is super informal. I just wanted us to have a conversation and also to just kind of let people know what's going on. I'm in the airport, so you're driving. I'm in the airport. I think we're equal, so I think we're good. All right, so, Ola, how about you just briefly introduce yourself to everyone?
Okay, can you hear me
Hmm.
okay?
I can hear you.
Okay,
Hmm.
wonderful. So, my name is Ola Davies. Actually, married name Banjo.
Hmm.
So, it
Okay.
always takes me a while to remember that. Um, but yes, as was mentioned, I am a pharmacist,
Hmm.
and I have been so for about 11 years now. And I practice in Maryland currently, but I'm licensed in several states.
Okay.
So, I know one of the things you're questioning is essentially, what are some of the qualifications that go into a pharmacist? But I did graduate from Howard University. In Illinois and Chicago. So it was a community-based residency just focused on advanced patient care and how to take care of patients in an ambulatory setting.
Okay. Ola, give me 1 second. I'm trying to put a little bit
No
of volume
problem.
on you. And if you guys know me, you know I'm always technically challenged. All right. So, Ola, do you mind repeating just that last part for me? Can you hear
You
me?
said repeat the last part?
Yep. Mm-hmm.
Okay, so I said I graduated about 11 years ago from Howard University. That's where I got my doctorate of pharmacy degree,
Mm-hmm.
and completed my year one community pharmacy residency out of the University of Illinois at Chicago, and it was a residency based on patient care in an ambulatory setting. So how to take care of patients in an outpatient setting.
Awesome, awesome. And what brought you into pharmacy?
I'm sorry, say that again.
What brought you into pharmacy? How did you
Oh,
develop your interest in pharmacy?
well, my journey into pharmacy, actually, I always wanted to be a pharmacist. Graduating from high school, I knew that I wanted to go into pharmacy. However, my first degree was in chemistry, so I did think, you know, I was going to become a, like a researcher, work in a lab, really start to work on how drugs are developed, things like that. And then going into pharmacy school, I now realize that, yes, I was still interested in the chemistry of medications, but I was definitely more so interested in, patients and how they took those medications. How did it better their health? What kind of outcomes did they have from taking the medication? So I switched over from more of the research and development mentality to more of the patient care mentality and into not necessarily just what makes this medication work, but what makes it work well when a patient is invested in their health care and they know essentially how and when to use a medication.
Got it. That's awesome. Awesome. So you've been doing this for how long now?
Yes, I like I said, I graduated 11 years ago from pharmacy school, so it's been a while.
A while. It's been a while. And have you always been
Yeah.
in the same setting? I'm not particularly familiar with if there are different settings for pharmacists compared to physiotherapists. Have you been in the same setting mostly, or have you changed around a bit?
I have been in the same setting. I like I said, I did my residency in a PGY1 in community pharmacy because I was really interested in the outpatient setting, really in retail setting when how a patient, um, uses and how they deal with their medication once they get home. So that was really my focus going into a residency program, and I've been in that setting ever since. So really just looking at the retail space and how we can impact patients on that level.
Got it. Awesome. Okay, so guys, you've gotten a little bit of background on Miss Ola. And I met Ola. Ola's actually a patient of mine, and we started talking about healthcare and medications. And interestingly enough, I had just done and put out a little bit of a video on how patients can like the questions that patients have when it comes to medications. And I put together this brief video that kind of talked about things that you should ask your physician. And as in my conversation with Miss Ola, we came across some really interesting things. So I put together some questions for Miss Ola that I'm just going to ask you, and Ola, you just respond as you can. Um,
No problem.
that will just kind of better help you guys to understand how her expertise is something that can be really helpful for you. So, Ms. Ola, so can you outline the training and the scope of your practice, and basically how what do you do? How are you trained, and how can you really help patients?
Okay.
Hmm.
So, just starting with kind of the academic portion. So,
Hmm.
pharmacists go through 4 years, sometimes 3 years in a very intensive program. It is
Hmm.
a graduate degree, and
Hmm.
you'll hear pharmacists refer to themselves as doctors. We do earn a doctorate in pharmacy degree.
Okay.
Back in the day, it was not, but we've seen more pharmacists actually go back and get that additional component to be
Hmm.
called doctor. So,
Got
with
it.
some
Okay.
pharmacists, they'll complete a first degree. Some pharmacists can actually go straight into it and
Hmm.
complete it as a 6 year degree.
Okay.
With regards to what we actually learn, it's actually a very comprehensive, very intensive program because if you think about it, we're pharmacists, right?
Hmm.
So we start off with the basics, pharmacology, anatomy and physiology, biochemistry, because before we can start telling patients how to take their medications or really trying to figure out how it works in the body, we first of all need to know how does the body work,
Of
right?
course.
So,
Right.
get down to the basics of it. And then from there, we grow and we add on the layers.
Hmm.
So at the end of the program, not only do we know essentially how the body functions, but how certain medications work with receptors in your body, what particular parts do they target, what, cells. So really down to the intricacies of, how everything functions.
Okay.
As far as scope of practice goes, at the very basic level, pharmacists, like I said, know how your medications work. They know what medications treat what diseases, what medications can prevent certain illnesses. And when you now go to on a state by state level, it then changes. In some states, pharmacists are allowed to prescribe. In some states, pharmacists are allowed to, enter into collaborative practice agreements with physicians, where physicians will confer authority to prescribe, change medications, alter regimens on those pharmacists. So it really depends on what the scope of practice is in that particular state.
Got it. That's a lot. That's a whole lot. So, question for you. So, do the things and the medications that you guys learn about and are experts in the same as physicians, or is there differences?
It's again, it comes down to what your specialty is. So
Okay.
pharmacists, even outside after completing the pharmacy degree, can complete a residency.
Mhm.
So I completed mine in community pharmacy,
Mhm.
but you can even go as far as pediatrics, neurology, nephrology. I mean, the it's
Okay.
it's unlimited.
Got
So
it.
at that point, you start to become more specialized in that particular disease state. Um, so, at the end of the day, your scope of practice does align with physicians, and it really helps us to complement what they do as well.
Okay.
So, there are definite differences between the two,
Mhm.
but if you look at it, we're in the healthcare field, right? So our
Yeah.
education is there and our knowledge base is there to complement what our other healthcare providers do.
Awesome. Okay, so that helps me understand better. So just like basically any other healthcare provider, there's specialties, and then you can branch off into the specialties and learn more about that stuff. So then you'd understand the
Exactly.
medications and how it works for that population base, basically. Correct?
Exactly. Yes.
Awesome. Okay, and yours is in community health, correct?
That's correct. Yeah.
Okay, awesome. This is good. So, guys, I don't think that you guys knew about that, but pharmacists can have the same specialties as a physical therapist, as a physician, so they can specialize in pediatrics, geriatrics, to my
Mm-hmm.
understanding, and
Yes.
another
Yes.
specialty populations that kind of complements their knowledge of medication that goes along with that specific specialty. That's awesome. So, what is one thing that a pharmacist can help a patient with that they may not know about right now? Or like a common misconception that the public has about pharmacists?
Um, I'm going to speak from my experience working in community. So I would say a
Mm-hmm.
common misconception that a patient has, some patients, not all, that some
Mm-hmm.
patients have is,
Yeah.
why do pharmacists concern themselves with my therapy?
Okay.
So some patients come into, when they go to their local pharmacy, they bring a prescription in and they say, hey, here's what my doctor recommended. Can you go ahead and fill it?
Uh
And
huh.
then when, as pharmacists, we start to ask more in-depth questions, what allergies do you have? Did your physician tell you why you're taking this? What condition do you have? And then we start to say, well, is this really the best medication for you? Or we
Mm-hmm.
think it should be a different dose, or it should be a completely different medication entirely.
Mm-hmm.
Some patients then start to say, well, that's not your job. Your job is to fill the medication because my
Ah.
physician said this is what I should take. But at
Right.
the end of the day, we know the human body, we know how medications work, we know what will best target, that specific illness or disease state. That's why we ask those questions.
Got it.
So when you say what are some common misconceptions, it's really that, misconception that has nothing to do with us. So it takes some time and education on our part, really getting the patient over to understand why we're asking those probing questions.
Mm-hmm.
And the fact that we actually really do work hand in hand with physicians to make sure that your therapy is the right course for you. It's
Mm-hmm.
not a simple matter of just handing things out. There's so many things that we catch on our end after we ask these questions, especially when it might come to allergies or,
Yeah.
a patient's previous reaction to a medication.
Mm-hmm.
So we're really that last line of defense when it comes to making sure that this is the safest and most effective course of therapy for you.
Wow, I love that line, the last line of defense. And I think that's really important for a lot of people to understand. Even I didn't understand this because, again, I think maybe the public perception, if I'm kind of going off of even my perception, even being in the medical field, is that you just fill the prescription and that's it. You
Mm-hmm.
know what I mean? I can't say that I've ever had an interaction with a pharmacist where I've ever had questions asked, and or my doctor was like, "Well, your pharmacist is going to ask you these questions just to make sure." I've never had that kind of interaction, so it's really good for the public to know that if they have questions that they may not have been able to ask their physician, this is something that they can get that information, that knowledge base from you guys to really understand why they're taking medications and to make sure it's the exact right thing for them.
Exactly.
I think that's
Yeah.
so key. And I also think it's very key to understand that this is really a collaborative effect. We're all working on the same team
Mhm.
to make sure that the patient is getting the very best thing and the very best choice for that person and for that condition. That's awesome to know.
Exactly.
All
Yep.
right. So, what are the biggest concerns pharmacists have about patients understanding the use of their medications? What have you encountered?
The biggest concerns we have is, do patients really understand their therapy?
Mm-hmm.
You have some patients who are very, very engaged. When they go to their physician's office or even when they come to the pharmacy, they've got their questions in hand. They know exactly what questions they want to ask. They really want to understand their medications, their conditions, everything to do with them inside and out,
Uh huh.
right? So they're asking the right questions.
Mm-hmm.
The biggest concern is when the patient doesn't know.
Mm-hmm.
So you'll see sometimes when you go to your pharmacy and it's a new medication, your pharmacist will ask you, did your physician tell you what this medication is for? And you'd be surprised at the number of times a patient says, oh no, my physician just told me to treat me. So at that
Yeah.
point, kind of red flags go off, and we say, okay, well, how do we even know that we're treating the right thing? Like
Right.
I said before, is it the right dose? Is it the right medication?
Mm-hmm.
Is this really going to help you? So it's really having that understanding of what your particular condition is and really that health literacy. Is this something that has to be solved with medication or are there alternative treatments?
Yes.
Because medication is not necessarily always the answer, right?
Mm-hmm.
There's typically a step one, a step two before you start to say, okay, maybe I need to be put on chronic medications.
Got it.
So, really, it's something that I urge all our patients, my relatives, anyone that I'm in contact with, is ask the right questions. Any
Mm-hmm.
healthcare provider that comes in contact with you has a duty to make sure that you fully understand everything. If you don't understand, you keep asking those questions until it is crystal clear.
Right.
And don't ever feel like you're wasting anyone's time or they're too busy. I mean, you are the patient, you are the client.
Mm-hmm.
Your services is what keeps all of us in business. So you have every right to take up as much time as you want to make
Right.
sure that when you walk out of there, you have a confidence that I've been heard
Mm-hmm.
and the message that I have received, I'm comfortable with the fact that this is the best recommendation for me.
Good. No, that's so encouraging to hear. This is something that I really encourage with a lot of my patients to ask questions, and I'm like, ask questions of everyone. You have one body. This is your health. You have to be an educated consumer of your health. And the only way that you would understand that if you are not a practitioner yourself is if you ask questions. And a lot of people don't feel empowered to do that. So it's encouraging to know that coming to you guys as a last line of defense if they're not able to have that be done at the physician's office or at a physical therapist's office for any other reason. And I do think that the setting and the way that your healthcare is delivered does influence, the ability to ask questions and to feel comfortable doing so. But it's good to know that you guys are able to say, you know what, you can come in and ask these questions. That's awesome. If you had to pick three questions, Ola, that you would say is important for patients to ask about their medications, what would they be?
Huh.
I'm putting you on the spot here.
Yeah, I know, right? Okay, so the first question the patient should ask is, you know, essentially what condition or what is this medication used for? Now, I'm making the assumption that the patient doesn't already know that, right? But if they come in knowing what it's used for, what it's indicated for, we can kind of throw that question out, right?
Okay.
The next thing is, how will this medication affect me?
Mm-hmm.
What are the side effects? Are there any things that I should be concerned about? Are there any adverse reactions? Is there anything that I should know? Because when you look at patients and their lack of adherence, it's due to side effects that are already known from taking that medication.
Okay.
So I mean, I'd be so bold to say as 9 times out of 10, if patients were properly informed about what side effects they could anticipate, they
Mm-hmm.
would be more likely to stay on a course of therapy because they'll say, oh yeah, my pharmacist told me this would happen versus, oh my
Right.
goodness, I don't know about these side effects. I'm not doing this anymore.
Right. Right.
So another question a patient should ask really is how long should I be on this medication for?
Mm-hmm.
Because we'll see sometimes patients come in and filling acute medications for acute issues that
Mm-hmm.
really should have passed. And we start to think, wait a minute, are you not any better? Are you filling this only because you have refills? do you know when essentially you're supposed to stop? If you're on
Mhm.
a 21-day, 7-day course of therapy, it should end at that point.
Got
And
it.
then to add on to that, you
Mhm.
shouldn't stop it before that point either.
Of
So,
course, and a
with
lot of people do that. Yeah.
they do
And
that
I
with
think to.
antibiotics. I'm sorry, go
Mhm.
ahead.
Oh, I was just going to say exactly what you're going to say. I feel like people, when they come with antibiotics, they see a really big
Exactly.
improvement in 3, 4 days, and they're like, "Oh, I'm fine," and then they don't finish it out,
Yes.
right?
Exactly,
Mm.
exactly.
Yeah,
So, it's those recommendations as far as the length of therapy, it's there for a reason.
yeah.
And it's really to make sure that your system has completely cleared the infection, you're decreasing your chances of resistance, you're
Hmm.
essentially making sure that you are completely whole.
Yeah.
So it's very
Hmm.
important to keep taking it.
Hmm.
And then, really the last question that I would say you should ask your local pharmacist is, is there anything else that I should consider? Like, what else should I be aware of that's going to really improve my health, improve my outcomes? And the reason
Okay.
I say that is because, you'll see when you go into your local pharmacy, they say, "Oh, are you up to date with your immunizations? Have you had this vaccine or that vaccine?
Hmm.
Have you considered this health and wellness service?" And the reason we're
Right.
doing that is we're looking at the patient holistically. So
Hmm.
it's not just about that one medication and solving that problem, but we're also trying to offset other conditions, other issues.
Right.
And I'll give you an example with that, especially for our senior patients. We had a
Hmm.
patient come into our pharmacy, actually two patients,
Okay.
husband and wife, came into our pharmacy, and pharmacist dispensed medication and said, "Oh, Miss So and So, have you had your pneumonia vaccine?"
Hmm.
And the patient said, "Oh no, I haven't had it." So the pharmacist said, "Well, you know what? I've got time right now. It's covered by your insurance. Let me give you your pneumonia vaccine. We want to make sure you're protected." About a month later, the
Hmm.
husband came in and said, "You know what? I just had to come in and tell you guys." And he was, his voice was breaking. He said, "My wife is in the hospital.
Oh, wow.
She got sick. And the one thing that the physician said to us was, 'Thank goodness she had her pneumonia vaccine, because this could have been much worse.'"
Oh, wow. Wow.
So when we make those recommendations, it's not, to push things off on you, but we're looking at your, disease state. We're looking at your age. We're looking at, even where you work, your work conditions. Are there certain things that you could be exposed to, and what can we do to make sure that we're preventing, other issues, to really offset any other kind of additional issues from occurring?
Wow, that's really amazing. It's really interesting because I think there's so much that needs to be done in terms of public awareness to really understand what you guys can really offer people. Like it's amazing that that was
Mhm.
able to be done. I'm so happy, and I hope that that husband and wife pair is okay. That's
Yes.
a crazy story. All right, moving on. Any comments on the use of opioids? This is a little bit of a hot button topic, and I like hot button topics.
It is. So,
um, mhm.
go ahead.
So I guess my question is: are there things that pharmacists that you have seen in your practice that can do to assist with
Mhm.
battling this crisis in terms of patient education, anything like that? Any comments on
Mhm.
that?
Right. So, just like I said, there's a lot going on with that.
Yeah.
States are starting to pay attention. Nationally, we're starting to pay attention.
Hmm.
If you heard some of the several State of Union addresses, that was one of the issues that was actually brought up, because it is a huge concern to citizens, patients, even non-patients, because of the points of access for getting these medications. So, pharmacists are playing a really significant role in this, because as far as the legal means of obtaining these medications, it is coming from the
Hmm.
pharmacy. So
Right.
patients who are taking medication for pain,
Hmm.
and then for whatever reason, maybe their pain not being managed properly, they
Hmm.
continue to take these medications. They become dependent on it, or even family members, non-family members getting a hold of patients' medication.
Right.
So there's so many issues going on with that. So several things have been put into place, starting with the DEA, the Drug Enforcement Agency, saying, "Look, pharmacists, now we really need you to be kind of, really the gatekeepers of this, right? So if
Okay.
something comes across, if you see an opioid medication with maybe a benzodiazepine, another medication that could confer additive effects, we really want you to, take a hard look at this. What are the patient's chances of, overdose? Making sure that they have the antidote, which is the naloxone, the could be the nasal spray, it could
Yes.
be injectables, making sure that they have that antidote in case they accidentally overdose. So what we're now doing, and for those of you who are on medication, you could see that when you go to your pharmacy, even if you've been on the medication for a long time, or especially if you're a new patient, your pharmacist is saying, hey, would you, we really recommend that you have this naloxone on hand. And, it's really, we need to take the stigma out of it. It's not saying that you're going to deliberately misuse a medication. 8 out of 10 patients who do suffer an overdose don't mean to overdose.
Right.
Right?
Right. Yeah.
It is accidental. So
Yeah.
just making sure that, hey, if anything were to happen, if you mistakenly mixed it with alcohol, if you took two medications together that you didn't realize would confer additive effects, you have a way to reverse the effects of that medication and keep yourself safe. And I'll give you an example, because I mean, I'm very passionate about this, with patients understanding that there's no stigma to opioid
Yes.
overdose. There's none whatsoever.
Yeah.
It can happen to anyone, anywhere, at any time.
Yes.
And when you hear that word, don't only think, oh, it's drug addicts or people who are looking to get a high who suffer from this. It could be anyone.
Yeah.
We had a patient come in, and she'd actually called the pharmacy and said, I used a fentanyl patch for pain. And I didn't realize I had on my patch and I used a heating blanket. Now, for us, that's a red flag, because
Yeah.
heating blankets actually cause the medication to be released faster into the system.
Yes.
And she
Yes.
had on her heating blanket with her fentanyl patch, sent her into overdose.
Wow.
911 had to
See?
be called. She was rushed to the emergency room. And this is a patient who legitimately was using a medication, but because of a seemingly innocuous action on her part, actually caused this overdose effect. And she actually came into the pharmacy for her naloxone. She said, I want this naloxone because if I had known that something that simple could have prevented this cascade of events, I would have taken it. But never in my life would I imagine that I would, even overdose on something that I've used for a long time. I've used responsibly, with, no ill intent of, abusing this medication.
Right. That's so interesting. And I really think we need to talk more about getting the stigma out of the way, in terms of making sure people are educated of what their options are. On my side, in terms of what I see in the clinic, patients that have chronic pain symptoms and that have comorbidities. So you have, if maybe type 2 diabetes or hypertension, heart problems, and they are on a lot of medications. It's so important for them to really get out of the way of really asking more questions about how these medications interact, because without that
Exactly.
knowledge, you really cannot protect yourself. And as you said, you guys are kind of like the last defense. So I think that's so important. I'm happy that you guys are on the ball with that. So just two more questions for you. So in terms of physical therapists, this is interesting. I've not spoken to a pharmacist in this depth before, so I find this really fascinating. What do you think that physical therapists can do to help with these problems that you're discussing? How can we contribute to helping out a team?
Okay, well, I mean, obviously I see you, so I
Yes.
believe in physical therapy. And it's really done wonders, because you know I mean, the healthcare profession, it goes hand in hand, no matter what your specialty is, right? So when patients come to see physical therapists, I mean, you get down to the root of the matter. What's bothering you? What actions do you take that are contributing to this pain? What have you used for this pain? So really just hearing how long patients have had that particular issue, what are they using to address it? And then I really think just knowing, okay, has this medication helped? Has it not helped? Is it only helping you for a short term versus is it conferring, like long acting, pain relief for you? Is, very, very, it goes hand in hand with what we want to know as well. And then really just incorporating physical therapy, knowing, the right movements, the right treatments really to offer this patient, and helping them get off of medications that are not really solving the problems. In some cases, it's just more so a band-aid, right?
Yeah.
It's just making them feel better for any moment in time, just getting them through their, daily activities. So really just allowing patients to understand that, hey, and I'll give you an example, maybe taking a steroid first, to help with, your pain is not a long-term protection, right?
Of
It's
course.
only going to help this for a little bit. Now, do you want to be on steroids for the rest of your life? No.
Of
So
course.
maybe
Yeah.
then going into physical therapy and really taking the time, making the investments to get the right treatment is it's a better idea. It makes more sense than continuing to come back to the pharmacy to fill 21 days of steroids just to get you through.
Of course, of course. No, I think that's important. And I do think as healthcare providers, we do need to make a better effort to work hand in hand with each other. Like everyone
Exactly.
so often is really in their own silo of like, I just do physical therapy, I just do medicine, I just do pharmacy. And too
Mm-hmm.
often we're not communicating with each other. And it takes a lot of time and it takes a lot of effort on the patient side to complete the loop of all of those specialties to make sure that they're getting the best care. And I do believe that we can do a lot better job of communicating within the professions to make sure that the patients are getting the best outcome. That's not something that patients necessarily have the expertise to do, to understand what you do versus what I
Mm-hmm.
do and how those interact and how it can best serve them. And I think we
Right.
do need to do a better job of linking those together to make sure that they can get the best care that they should have. You know.
Mm-hmm. And to your
Um.
point, I think the
Mhm.
onus is on us as healthcare professionals to actually understand what each of us does, right? What is
Yes.
each profession's scope of practice? We might not know the entire scope of practice, but at
Mhm.
least being able to make the appropriate referrals. So,
Mhm.
even as a pharmacist, for example, if I have a diabetic patient, I'll
Mhm.
say, well, you need to go see your podiatrist to check your feet because,
Mhm.
diabetics are, more at risk for, abscesses and wounds and any kind of, you know, skin breaks that might actually, cause them further harm. We say check with your nephrologist, check with
Mhm.
your eye doctor, you should see your dentist. So making those appropriate referrals, we should all be doing that because patients are not
Good.
necessarily going to think of that on their own.
All
And it
right.
also helps them to know that we all work hand in hand, right? So
Mhm.
if I'm recommending something, I'm not doing it counter to the wishes of your physician, but
Right.
it's more than adjunct to what is already going on. And by all means, if you're not sure of that recommendation, always have your pharmacist, have your physician, have them talk to each other, have them call each other, share that
Yes.
information so that we
Yes.
can check in and say, hey, what are we doing to better manage our patient, our common patient? This is something that we have in
Yes.
common.
Yes.
And we all have the same goal, which is to improve the patient outcomes, get them better.
Yeah, no, I, I, I wish I could put you on a bullhorn. I think this talk needs to be talked about so much. And I really strongly advocate and encourage a lot of my patients and even people that I encounter that are not my patients. Talk to your physician and demand the care that you want. If you feel that you have three healthcare providers and you're being pulled in three different directions and you're not sure where to go, they should be
Mm-hmm.
able to pull all of that information together for you in order to make the best decision for you. Make sure that they're all talking to each other. Um, and right now, in terms of medicine, it's so specialized. There's so many specialties and silos. It's really important. It's even more important to have that comprehensive look. And yes, the doctor
Yes.
is usually the head that's really kind of leading the team. But if your doctor is not giving you the outcome you want, or your dentist, or your physical therapist, or whoever is not giving you the outcome that you want, there are more healthcare providers out there that will be able to give you that information, that is willing to communicate with
Mm-hmm.
other people to give you that comprehensive care that is really the best way to deliver healthcare. So I'm all for everything that you're saying. So we talked for a while. I'm just gonna wrap it up. Last question for you. Is there a thing that you wish you could change that can benefit patients with when it comes to handling their medications?
I'm, I'm gonna say something that probably all, practitioners would say is,
Mhm.
I wish we had more autonomy
Mhm.
in terms of, if my patient comes to my pharmacy and they have a prescription for a medication that we know is the absolute best decision for them. This is what is going to get them to feeling like 100%, to feeling like
Mhm.
themselves. I
Mhm.
wish I had the autonomy to say, hey, look, insurance company, you can't dictate what is first line, second line, before the patient tries this. You
Ah,
know,
that's
um,
interesting. So
what barriers can we
tell me
remove?
more about that, because I don't know that a lot of people are aware of that, and I'm very little
Oh
aware of
no.
that. Tell me about first barrier, second barrier. What exactly does that mean?
So, with certain insurance plans, for those patients who actually look into the specifics of their insurance plans, they do have preferred medications, they have second tier medications, maybe third tier medications, and a lot of this is dictated by cost. So if
Okay.
you come up and say, I have this condition, your physician might say, hey, look, this is the best medication for you. I'm going to put you on it right away because it works like that. The studies have proven that it's the best thing. And, based on all of your symptoms, this is the direction we're going to go. You
Okay.
can go and get it filled. And then the pharmacist says to you either, oh, it's not covered by your insurance. I'm sure we've heard that before.
Oh
Or
yeah.
your
Mhm.
out of pocket cost is going to be $500 or $400.
Mhm.
That's because the insurance is essentially putting a block on it and saying, oh, whoa, 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 before you try this medication, which is probably expensive, we want to try you on something cheaper because it kind of works the same. You know, it might help. At least try it first and see if it'll work before we put you on this other one. So sometimes you'll hear a pharmacist say, we need a prior authorization. So essentially bouncing it back to the physician to say, hey, doc, look, the insurance is not getting it to go through. I need you to explain to them why this is so crucial.
Uh huh.
Now, of course, none of this happens in a 5, 10, 15-minute span of time.
Nope.
We're talking
Nope.
days, maybe weeks. And in some cases, maybe it never even happens because the insurance says, look, that reason is not good enough for us. So
Right.
you're just going to have to try it. Or they'll say,
Wow.
okay, fine, you can try it, but your out of pocket cost is going to be pretty hefty. So, how
Right.
badly do you want this? I mean, we've seen patients come up to our counters, they want a medication, but when they see that out of pocket cost, they're like, there's no way I can afford that. I'm not going to make the decision between getting this medication and, putting food on my table, or getting
Right.
this medication and being able to turn on my light bill. I mean, it should never be like that.
Right.
So, when I say I wish we had more autonomy, I wish we could say, look, this is what is going to get our patient to 100%, and
Mhm.
it's probably going to take less time and effort than battling, going back and forth,
Mhm.
making these explanations of why this is crucial.
Got it. Got it. That's a big ask.
Yeah, I know it
It's a
is.
big
Hey, you
ask.
said I should ask, pie in the sky,
I know it's a big ask, and I interestingly, um, in terms of even how I practice, I've found a way around it by going and working with insurances, but on a limited basis in terms of an out of network provider, because I just knew that having that third party in the conversation between a provider and a patient was not beneficial to the patient, and I was frankly tired of it. That's how it came about for me. But for you guys don't have a choice. You guys have to use
Yeah,
insurance. You have to work within that model. And it must be really frustrating to have to go back and forth and figure out if someone needs heart medication or diabetic medication, that, insurances are kind of pushing you back into second or third tier choices when there's
mm-hmm.
one medication that can really benefit a patient and resolve the situation right away. But because of the costs, they are kind of punting it back, to you guys. That must be really frustrating. Is there a solution to that outside of insurance?
um to be honest with you, I don't know. I don't know what it is. I really
Yeah.
don't know because so much is driven by the cost of medication in this country.
Mhm.
We've gone to a point where patients cannot afford to pay out of pocket. I mean, very few people can afford to pay out of pocket for their medication each and every time. So we are
Right.
limited by what insurance companies dictate.
Mhm.
At the end of the day, maybe the best, like, low hanging solution is find the insurance company that works best for you.
Right.
Easier said than done.
Of
For
course.
some of us, in my workplace, we
Mhm.
get an option of, three different types of insurance plans. And if we want that, discounted rate, that preferential, in-network status, you're limited to those three.
Right.
For our senior patients with Medicare Part D, you can actually, during the open enrollment season, go online and take a look at, what plans, what are the ratings, what's the feedback, what medications do they cover. So you can actually plug in your medication. You can
Mhm.
plug in, your conditions and say which one of these plans will essentially treat me the best, will really allow
Right.
me.
That's
to have
important to
what I
know.
need.
Yeah.
Right.
Mhm.
So, really just utilizing all of those resources. Another frustration of mine is, when they deem certain pharmacies out of network, it's not necessarily the most convenient option for the patient, or they've built a relationship with this person,
Mhm.
but because this pharmacy is out of network, they can't continue to go there. They can't continue to visit that location.
Mhm.
I'll give you an example. My insurance plan has specific locations that are in network,
Mhm.
and I remember my 3-year-old was sick, so I get the prescription from the physician,
Yeah.
and my local pharmacy didn't have it in stock, but it was something that I needed that day.
Mhm.
Um, so, she said, hey, let me call this other pharmacy chain that's literally next door
Mhm.
and see if they've got it in stock. They had it in stock, but guess what? My insurance said, you're not a preferred pharmacy, so we're not going to pay for it.
Wow. That's
So
crazy.
I had to call 3 other locations that were in network before I finally found a fourth location, which was a bit of a distance away, but it was in network.
Mhm.
Right. So again, that access, think of all that time that I spent calling around looking for it, and my child is not feeling well, right?
Yeah.
This was therapy that I should have started on already. But because I'm spending time, running around town looking for, first of all, who has it, if they have it, will my insurance, accept, that billing. So it's,
Yeah.
there's so many factors involved.
Wow.
Life, I realize, is not all about conveniences, but when it comes to matters of healthcare, it, some concessions I really feel like should be made.
Agreed. Agreed. I completely agree with that. And I definitely don't have a perfect solution to that either. I mean, the best that I can offer you, if I had the power to change everything with a snap of my finger in the day, and I could be queen for 2 years or something like that, and my power was absolute, I would just definitely say that there needs to be price regulation. I do think that's the base of everything.
Yes.
If
Yeah.
prices are regulated and it's similar across the board, because the issue is not, again, not access, in my opinion, it's the cost of it. And I think if that's regulated, then a lot of things start getting evened out. Because even the fact that they are saying, no, you can't get this medication at this pharmacy because you're not a preferred provider, centers around the cost of it. They don't want to pay
Exactly.
extra for it. So we take that out
Right.
of the equation. And a lot of the decision making things that delays effective healthcare and delays good healthcare, it goes away with it. So that would be my magic wand. If I had a magic wand,
Yeah.
that's what I would do.
That's it. Yeah.
Yeah. But Miss Ola, thank you so, so much. This was awesome talking to you. I learned
My
so
pleasure.
much,
Thank
and I
you.
really hope, I feel like I'm probably going to get comments after. It's the middle of the day, so, and it's Friday, so people are probably like trying to get out, enjoy the rest of the sun while it's
Right.
out there.
Exactly.
So I'll definitely, if anyone has any questions, kind of punt it over to you so you can answer those questions. Guys, this is Miss Ola Davies. She's a pharmacist. She recently was actually on TV. I did see
Oh
that
my goodness.
little video of you. And so this is a very well known pharmacist. She's very good at what she does, very, very knowledgeable. So I encourage you guys to check it out. I will get that clip and that link and post it in the comments so you guys can check out more about her. Um, these are things that you guys need to know about in terms of understanding medication, understanding what your healthcare providers, including your pharmacists, they don't just hand pills to you. They are way more than that. They're way more educated than that. They're way more knowledgeable than that. So I would love for you guys to really start asking questions of your pharmacist to make sure that the information that you're getting from your physician, not that you don't trust them, but to make sure that you're getting exactly what you need to get better. So I appreciate you so much for coming on here
All right.
on a
Thank you. Thanks for
Friday.
having me. I know. Yeah. Thanks
All
for having me.
right.
And a little shout out to you, physical therapist extraordinaire.
Oh, thank you, thank you, thank you. I try. You'll do the hard work, and I just direct.
Well, yeah.
All right. So thank you so much for coming on
All
here,
right.
and I'll see you soon, and I'll see
Okay.
everyone else later. Have a good day, guys, and a great weekend.
Thank you all.
All right.
Bye.
Bye.